this video today, you're going to see us evaluating the horse. The horse has pretty bad hock arthritis, so you're going to see us doing an evaluation, kind of picking the lame leg, doing some flexion, seeing where he's sore. He also happens to have a pretty bad club foot on the right front, so you're going to see some right front lameness as well. The primary thing we're trying to manage on him is juvenile arthritis in those hocks and keep him performing as those hocks kind of continue to progress and eventually are going to fuse. And the goal is once those fuse, they do so in a decent manner, then he's going to be more or less pain-free back there and should be able to go on and have a good career. I don't know if I told her. Here to here is your central tarsal bone, and that's about normal kind of thickness for it. And then you should have a third tarsal bone from here to here as well, and that should be about the same thickness. So he pretty much completely crushed that third tarsal bone, and then that pathology set him up for the fusion here in the distal intertarsal joint, and some partial fusion here, and then that's why you have this weird margin here. So he's got a little, I don't know if I call it a slab fracture exactly, but there's fracture-like pathology in there from that trauma due to incomplete ossification or incomplete development of those cuboidal bones. And that's same on both hocks, which a lot of times when that happens with our youngsters, you do see it on both. We're going to do some injections on this horse's hocks. He's got some pretty bad juvenile arthritis with some old, basically crushed fractures, some fusion. So we're going to put some pretty potent, long-acting anti-inflammatory in there, and hopefully keep him quiet, keep him sound while those things go through their fusion process. Bottom, the very bottom. This is a not uncommon problem that we see. Basically, how this develops is foals born, those lower hock bones, the cuboidal bones we call them because they're kind of shaped like cubes. They're not fully mineralized, they're not entirely developed, so it's not entirely bone. And they can basically squish those things, and then you end up with hocks that look like this guy's here. So you can see that we've got almost full fusion of this distal intertarsal joint. We've got some decreased space in some areas where it has fused in this tarsometatarsal joint. Completely abnormal shape of our central tarsal bone, and even more abnormal shape of our third tarsal bone with some kind of old fracture lines running through there. So this horse is affected on both hocks. You can see the right hock is even more abnormal. He does have more joint space in this distal intertarsal joint, but you can see this third tarsal bone and even the proximal, or the top part of this metatarsal bone, completely abnormal. A lot of irregular bone densities. All of our bone margins are irregular. And this is the leg that he's most lame on right now, this right hind. We're trying to help him out, trying to get these things to fuse, trying to get them to quiet down. We put some steroids in there today, mostly targeting this this tarsometatarsal joint, the lower hock joint right here, since there is some more space there. And you can see there's really not much of a joint space in that distal intertarsal joint. On the right hind, we did do an x-ray guided injection to see if we can get a little bit of anti-inflammatory in this distal intertarsal joint. We got a little bit in there, but main focus was trying to put some steroid anti-inflammatory in this tarsometatarsal joint. So that's what we did for him today. Another thing you could try to manage these things would be Shockwave. Give him a bone medication called Osphos or Children. That may delay the fusion process, the Osphos or Children, but I think in some of these cases it's worthwhile because you do decrease the amount of bone pain as they're still performing, still fusing, and then eventually they're going to end up fusing almost no matter what. Some other ways to manage this other than the injections that we did today would be surgical. So you can actually go in there, basically debride the remaining cartilage, and that'll encourage those things to fuse quicker. You can inject alcohol into those joint spaces that are remaining, and that degrades the cartilage. So you get the rest of that remaining cartilage out there by injecting the alcohol in there, and then it actually is truly bone on bone, and that'll facilitate fusion as well. So a lot of different options as far as kind of more conservative management to a little bit more aggressive. We're going conservative on this guy. He is still in work, still performing, having a little bit of an issue here and there, but for the most part, I think we can keep him performing pretty well with hocks that even look this bad.